Good afternoon, and thank you everyone for joining me today for another Leadership Dialogue session. I'm John Haupert, President and CEO of Grady Health System and Board Chair of the American Hospital Association. For those of you who tune in regularly, you will remember that I had the opportunity to speak with the dynamic team from UAB Health and the University of Alabama, Birmingham a few months ago about how they are partnering to bolster their nursing pipeline in their local market. And today I'm joined by a colleague and friend, Mary Beth Kingston, for a related conversation. Specifically, we will talk about nursing leadership trends and strategies that can be impactful at the hospital field as we continue to look for new approaches to address ongoing workforce challenges, which I know we are all experiencing. Mary Beth is Executive Vice President and Chief Nursing Officer at Advocate Health. Advocate Health is an integrated health system comprised of 67 hospitals, more than 1,000 sites of care located in 6 states. The health system has over 150,000 teammates, including nearly 42,000 nurses. That leadership alone gives Mary Beth a unique perspective and expertise. But she is also a past president of the American Organization of Nurse Leaders and now serves as a fellow AHA board member. So with that, please join me in welcoming Mary Beth Kingston. Welcome, Mary Beth.
Thanks, John. I'm thrilled to be here today.
Great, good to see you. So let's dive in.
Sure.
Let's start with a general question about what you are seeing. What are some of the nursing trends you are seeing within Advocate, such as new care models, locations of care, telehealth, those types of things?
Well, it's interesting. I think we've been focusing a lot recently on, nursing and nursing care models and delivery of care, but I like to think of nursing within the greater context of the healthcare system. So when I think of new care models, I don't just focus on nursing, even though I'll give some examples of things we and others are doing. But I do think it's important for us to say, how does this fit into the larger healthcare system delivery and the changes that we believe we know has to happen? One example is really tapping into nursing as we all work to close the gaps in health equity. I don't think we've really harnessed the power of nursing in being able to reach those goals. So that's one big area that I'm currently focusing on. So if you go back and think about some of the things we're doing and others are doing, the most important thing for me, as I think about it, is to take a step back and look at the work that needs to be done. And this probably goes for general care delivery as well as nursing. But who's doing the work and what is that work? So I get very nervous when we see new technology and we say, oh, this is great. And we keep adding it to what we're currently doing, because I think that just adds unneeded complexity to care delivery. So looking at the work that needs to be done. One thing we've done is we've brought some folks in to just sit and watch what nurses are doing, in this case, particularly in the inpatient setting. And we did this years ago nationally in transforming care at the bedside, but we didn't really focus on technology in that. And so I think that's going to be the difference. So what is the work? And if a manager, for example, is doing a certain type of work, could that be automated? What could easily be automated, or what should someone else be doing? Because right now in the beginning, I think we've got to look at efficiency and effectiveness in a lot of our care areas. So with that being said, there are some technology things that I'm excited about as well. Obviously, artificial intelligence is a big issue, and we have begun to look at some algorithms for different care processes, but also looking at them for nursing as well, in terms of helping. And a lot of this we were doing earlier, more predictive modeling, but in terms of helping us prioritize the care that needs to be delivered. Another area in the efficiency and effectiveness arena is the ambient listening technology that's out there. And our physicians have really started looking at that. And I waved my hand and said, wait a minute, what about us? So that while you are talking, this technology is creating your notes and at times looking at potentially whether it can even help with your flow charts and those kind of things, really decreasing the documentation time, because no one wants to spend a lot of time sitting at the computer documenting. And there are many other things we're doing to decrease documentation time, simple technologies. And again, automating things when we can. The other area, and I think you've heard this from probably a ton of people, is virtual nursing. And I do think that virtual nursing has tremendous promise. I'm not sure it's going to help us, in a great way in terms of, filling the big gap when we don't have enough nurses. I do think it helps a little bit there, but there's a number of other areas where I think it's tremendously helpful. It does extend nursing. Some units, and particularly in my healthcare system, where we're rotating nurses through on it more of a unit-based model. I think that helps with retention, and it helps give people just kind of a bigger picture. And it's been demonstrated in my organization, again, to improve patient experience with more touches. So it helps a bit with the staffing issues, but it certainly has other benefits. And I think we're just beginning to learn more about that. Robots are another area. I had the opportunity to visit Christiana Care and saw a robot in action. I think this technology has potential in terms of gathering and doing some different types of tasks, but I think we need to really work with that and make sure it fits into the workflow and to be open to that. And then two last things I'll add, because I'm giving you a laundry list here. The hospital at home and remote monitoring, I do believe that these two areas are going to dramatically change the way we deliver care, and being able to monitor people and improve their health, but also, be able to manage chronic illnesses in a better way. And trying to figure out where the nurse's role is in all of that is something we're doing right now. But we have a very robust hospital at home program. And then, the other big trend is flexibility and autonomy of nurses. I mean, we have a workforce that is saying, hey, we need more flexibility in our work, and we want to have, not just an input, but we want to be responsible for our practice. And I think we're going to have to really pay, and we need to pay attention to those types of trends that are out there as well. Whew, long-winded answer.
No, great answer. Perfect answer. Thank you so much. And it's interesting. We talk about all the technology, which I agree with you. Some of it's going to be very beneficial. Some may just be additive, which we don't want to do.
Right.
But then that last one you hit about autonomy and flexibility is just a huge, huge issue that we have to be responsive to. You and I can remember back long enough when we were pretty rigid when it came to nursing shifts and how many hours people worked. And now we're finding that so many nurses want to be PRN, so they have the flexibility, and we have to accommodate that. We have to be able to work with people to be a flexible work environment, to provide that freedom to people. And I just think that's so important.
It is so true. I'm interrupting because I'm thinking of a conversation I had yesterday, and and I don't want this to mean that people are sleeping on the jobs at night shift, but we have a lot of people who are working that are really tired and fatigued, and particularly people on night shift. And there's some research out there that shows that if you take cat naps, a short cat nap, that your productivity and your energy level increases. And so, or at least you have less fatigue. And so there are some places that are looking at, could you, if very responsibly, and I mean, remember, if you fell asleep years ago, back when I remember, if you fell asleep at a desk and closed your eyes, you were gone.
That's right.
So are there ways to build in healthful practices that help people as they're providing care, and yet don't have a negative effect on the quality?
Absolutely right. And, I've read that same research, and, I actually have tried that, and it does help. It does work out pretty well. And you'll be glad to know no one's tried to fire me yet for doing it. So
Great.
good thing. So as you think about all of those different improvements or opportunities to assist in improving the care model and to lessen the burden on nursing, what do we need to do to support our teams and build a more robust workforce in the future? And how can we as hospitals and health systems rethink workflow and specific care team models to support different care models?
Yeah. I mean, my primary thing, I'll probably say this throughout our discussion today, is to actively seek out nurses and others at the point of care. Many times they have the ideas and potential solutions. So engaging but actively seeking out individuals that are there, I think is probably my top strategy that I would follow. Um, I also think it's important for us not to fight technology. I mean, there are many things that I've had to learn. I'm going towards the latter end of my career, but we have to work really hard to ensure that the entire workforce, not just our newer, younger workforce, but the entire workforce is embracing and looking at the opportunities, even in terms of delivering excellent nursing care virtually. This is not about, we may not have enough nurses, but integrating technology is not about replacing positions. It's about being able to provide care in a more efficient and effective way. Um, I think, I also think we have to understand that some of the things that we're talking about, again, virtual, this is different than providing direct patient care. And we saw that during the pandemic with virtual visits, that our patient experience decreased a bit because folks were not used to doing care virtually.
Mhm.
And I think that we shouldn't assume that everyone just can jump into this and be really good at it. What are the things that make a difference? So I think training and understanding what those differences are will be really important. I believe and I'll speak for myself here, I need to expand my knowledge of artificial intelligence, what that is, how we use it. And I think our entire workforce needs to and that's one of my goals in my organization, is to just begin to talk about it so we understand what the potential might be. But again, not fitting something into our workflow, but looking at the work that needs to be done and how this would enhance it. And then, another really important thing I think is that education. We have so many issues with clinical sites, and I recently saw some data on nursing and the enrollments, and the data showed that we are seeing some increases year over year, with the exception of the inpatient setting. And so I do think that's an area that we're going to need to focus on, and we can talk about work environment. But I also think that technology, we can incorporate that into all of our education using virtual reality and team-based learning opportunities that are now available. So there are a few different ways that I think we can help nurses and support them as we look at different models of care.
That's very good. Yeah, wrapping our hands around what AI is going to mean in care delivery. I know here at Grady, we use AI currently to assist with identifying potential patients who are becoming septic.
Right.
It works behind the scenes, and there's a notification system to the physicians. But things I've been reading about what it could do to greatly reduce some of the routine work that nurses and others do may be very promising. And I'm hoping we can reduce the number of tasks a nurse has to do in a given day, because it's just endless.
Right. And I think, John, that we've moved into this task oriented area that if you ask any nurse, that's not a rewarding place to be, to have a checklist and be checking everything off, as opposed to really focusing on the whole person. And I think as we talk about helping people connect to purpose, that's an important thing to remember.
Yeah, and one other thing you mentioned about clinical sites, I really do feel that's an area where our field needs to step up. I've already shared with Mary Beth a situation that occurred here in Atlanta with one of our largest nursing schools that had to significantly limit the enrollment in their BSN program because of clinical sites. And when we became aware of that, we agreed to become their exclusive clinical site provider with instructors and even with a simulation lab. And we've been able to increase their BSN enrollment from 80 per year now to 250 per year. And we will get to the point where it will be 500 per year. So I think hospitals need to understand what the needs are with the colleges in their market. In this situation, the college didn't come to us to talk about it until it was in a pretty bad situation. And so I've now taken a real interest in making sure we're working with the nursing schools to assist where we can.
Yeah, that's such an important point, John. There. We need to have a partnership, and it's clinical sites, and it's content and all of those things. But clinical sites and faculty are two areas that we've partnered very successfully with a number of schools.
Yeah, so let's shift the question just a little bit here. And I know this is something you think about often, but we all know that well-being and satisfaction of our healthcare workforce has taken on a whole new level of emphasis over the past several years.
Yeah.
And it's not just what happened during the pandemic, but so many different social issues and global issues that are impacting how people think and feel. What do you think we need to be doing as a field to help support the well-being of our associates?
Yeah, boy, I wish there was one answer to that. But, it's so different for each person too. But there are some things I think that obviously we can do. The first, and I think I've sort of alluded to this, is focusing on that work environment. When I do round, and especially when I rounded during COVID, people were just so stressed, and I would say, where are you getting your support from? And invariably, they would point to their coworker and say, "It's the people I work with. It's my immediate leader." And so, I think we've got to invest in leadership. Number one, and number two, one thing that we have found to be very successful are peer support programs. So, focusing on training of a wide variety of individuals from any nursing, environmental services, physicians, and doing some training with them on not for them to be the counselor, if you will, but for them to be able to be aware of the folks they're working with and who might be struggling, and to help them connect with resources. And there's more to it than that. There's a whole trauma-informed care approach. But I do think that building strong teams and supporting leaders in departments, in units, whatever setting you're practicing in, is probably number one.
Sure.
Recognition is really important. And I just was at a recognition event for nurses, and I'm telling you, talk about reconnecting to purpose, which is another strategy. We went around and asked each nurse how long they had been with the organization. They were all being honored for something specific, and what motivated them. Each story was just more powerful than the one before. And everyone was just very grateful for this recognition, as long as it's meaningful recognition. I think that's another important piece. We can talk at some point about this, but addressing workplace violence, again, that ties into the environment. We do know that has increased, and there's lots of strategies we need to employ for that. I would also say providing opportunities for growth and development. One of the things that you'll hear me say often is that what I find satisfying about work is when I'm in a situation where I'm learning and I'm contributing my talent. So am I using my talents in this role, and am I continuing to learn? And that to me is a great job then. But do you have a career path? Are we identifying kind of your unique talents and ensuring that you're able to use them at work? And where do you want to go, and how can we help get you there? I think that's another important piece.
That's great. You kind of touched on our next topic, but I know you are very engaged in the AHA's Hospitals Against Violence initiative.
Mm-hmm.
So can you share with us what you're doing at Advocate in regard to raising awareness, supporting staff, and any new policies or practices that you've implemented to help our nurses and entire workforce be safe.
Well, I could talk about this for a long time, but I do think it starts with leadership and the board. So, ensuring that everyone is aware of the issue and is supportive of strategies to decrease violence, and communicating that to all of those that are providing care. It also, in my mind, it should not be separated from the overall safety program. So we've very much focused on patient safety, which obviously is job one. But workforce safety is a piece of that. And we know that if people don't feel safe, they're less likely to be able to provide that safety to patients as well. So it all ties together. Strategies are different, but it should be viewed together. So we do a lot of work with trauma-informed care, understanding where patients are coming from, so that we can understand how they may react in certain situations. And we do training with that, and also de-escalation training. So I do feel that it's important to give people the tools kind of in the prevention area. Risk and threat assessment. So this is obviously the partnership with your public safety team or security, however you refer to that group, that is so critical. But looking at the environment and where we have issues, but also even more important now is identifying when there's a potential threat, following up on that and developing a plan to deal with that. In the prevention area, we're also doing, I think, really good work in clinical assessment. What are some tools that are, remove bias, where you're looking at a patient and identifying cues, physical and emotional cues, and then having a plan of care that goes along with that. So we don't want to identify something and not be able to do something about it. Then there's tactics, number of tactics. Folks will go back and forth on metal detectors, but there are some that they are useful in some situations. And then also others, weapons detection, which is a little bit different, new technology coming out. Certainly many folks have been moving towards, and we haven't employed widely yet, but we have them in a number of units and plans to employ the mobile buttons, the duress buttons that you can wear with your badge to get help. So there's lots of technology there too. But I think and then I'll just add support if something does occur. But I do think that the most important thing is to create that culture where people are identifying when something is unsafe, raising issues, approaching, having the correct training, and then having the support you need to develop a good plan of care when you identify a potential threat or behavioral issue.
There's several things you mentioned in that I just want to reiterate. If members of our audience haven't done any study or research on trauma-informed care, I'd encourage you to. It really does change the way we look at what the lived experience has been of our patients and how that lived experience is influencing how they may be interacting with us today. Of course, de-escalation training is essential. Once individuals know how to de-escalate a situation, it's less likely to become an issue. And I highly subscribe to those. And then you mentioned the weapons detection systems. We have moved to wide use of that new technology, and I find it to be a huge plus compared to old metal detectors. Much less invasive to the individual. Most of the time, they don't even know it's running as they walk into the building. And then the very few people that it will identify, you just say, come over here a second and have a chat and check their purse or whatever. And it's just much less invasive. So great job all the way there. So you mentioned a little earlier, and this will be my last question, but it's really back to this nursing leadership and governance issue. And I wondered if you would mind sharing with us key leadership practices or key leadership competencies that you think are essential today to build a strong culture that encourages decision-making and creating strong team-based care.
Yeah, I mean, I'm a huge proponent. Now we call it shared governance, but there's a move, and we'll probably move in that direction to professional governance. And to me, that ability to have nurses have oversight of their own practice, it creates so much more engagement. I've talked a lot about this, where as nurses bring forward things, and I meet with our shared governance leaders. And I have had our CEOs, we have co-CEOs right now, but I have had our CEOs ask to meet with shared governance leaders or ask their view on certain things, and then connecting those dots back so that people see, even if you're not active in that, your representative on that unit is soliciting information and then can bring information back. It's such a powerful strategy when it's done right. So I once read, it was one of the Harvard Business Review's book, going through Cotter's Change, and it said you really need an army to really do transformative change. And so, to me, shared governance, there's a top down and a bottom up, but then there's also this army that extends out. And so the messages are clear, and you're still getting input and new ideas. So I think you have to be a leader that values that and isn't a totally top down leader, but having a strong process there, I think, is critical. The other thing I'll just mention, John, that I worry about a bit, and that is our leaders at the point of care. We've had this huge shift. We're doing a lot of work right now on how do we reduce the burden for that nurse manager. And during the pandemic, when more folks went remote, a lot of work shifted to the manager. And we still haven't peeled all that back yet. And some of the things could be small, but they're incremental. And so now all of a sudden, maybe you've got to check for serial numbers, or you've got to help get access to whatever. And you add all of those tasks on. And then, as I mentioned, that support that the manager, that environment that they want to be out there creating, becomes very difficult because you've got this whole list of other things that you need to do. So I think investing in our leaders at the point of care so that they are comfortable having an open, transparent, interactions with their team and supporting their team, I think is probably that, and shared governance, probably the two most important things we could be doing.
Great. Thank you for that very much. Thank you all, for everyone, for joining me today. Mary Beth, thank you. As always, it's a joy to be able to share ideas with you. I've appreciated being able to do that over the last few years.
Thank you, John.
And I appreciate you sharing your great insights. And again, I encourage all of our viewers to explore the workforce resources available through AHA and through the American Organization of Nurse Leaders as you consider your own workforce strategies and partnerships. Until next time, thank you to everyone for joining us today. I hope you'll be back for next month's Leadership Dialogue. Thank you.
Thank you.